Welcome to #Wednesdays Weekly, a weekly information session in collaboration with voluntary sector and public sector partners. Today's session is delivered by Naomi Burke from Rochdale and Oldham Maternity Voices Partnership. Over to you, Naomi.
Oh, thank you, Hayley. Good afternoon, everybody, and happy International Women's Day. I'd just like to throw that out there. So my name's Naomi Burke. I work for Healthwatch Rochdale. I'm the Engagement and Volunteer Manager, but I'm also the lead officer for the Rochdale and Oldham Maternity Voices Partnership, whom Healthwatch Rochdale host. So thank you for joining us today, and thank you for people who are watching as well. So we're just going to do like a little bit of an overview of what the Rochdale and Oldham Maternity Voices Partnership is. A lot of people still haven't heard about the Rochdale and Oldham Maternity Voices Partnership, or they have heard about it, but they still don't know much about it. So it is only a brief overview. You can, we'll put all our contact details on as well, so you can always contact us after with any additional questions, anything else that you want to know. We'll do a question and answer session at the end. I have got a PowerPoint to share with you as well. We'll sort of like go through bits and bobs in it. I might not be able to see questions in the chat or anything like that, so I might have to ask Hayley to keep an eye on that, because I'm not sure sometimes when I'm sharing the screen. But yeah, so I will just share my screen now. Find my share screen. I'm beginning. So can everybody see that okay?
Yeah, we can see that.
Excellent, thank you. So yeah, so as I said, good afternoon. So Rochdale and Oldham Maternity Voices Partnership. The idea is that it's working in partnership to improve maternity services. So what I'll start with a little bit of an update about what Healthwatch Rochdale is and how we sort of like link in with the Maternity Voices Partnership. So Healthwatch Rochdale, there is over 150 health watches right across England. So they're generally wherever there's generally a council, there's generally a health watch somewhere within that area as well. We work really closely across the 10GM with Healthwatch Oldham, Tameside, Bury, Salford, Stockport. So we all work together. But also what we are is we're the independent voice for the people of the Rochdale borough. So every health watch is the independent voice for whatever that particular town, borough, or area that they're in. We listen to the experiences of residents and gather feedback. That's like one of our core key things that we do. And we're gathering feedback around health and social care. So it can be doctors, dentists, hospital appointments, eyes, ears, nose, throats, anything like that, what is like an NHS commission service. We're really always keen to gather in not just negative feedback, but we're also really keen to gather in positive feedback from across the borough. The idea of it is to give residents a stronger say in influencing how local health and social care services are provided. So the feedback that we gather in, we look at it consistently, continuously. We're looking at it, we're looking for themes, we're looking for trends, we're looking for, like, especially like month by month, it does, we do see dips and trends in things. We look at if we have certain areas that we need to look at a little bit further. If things are going well, we like to shout out about the services that are going well and give positive feedback out. If things might need a little bit of improvement, or people have found that things haven't been how they wanted it, again, the organisations who deliver these services are always really keen to listen to that feedback to try and make services better for the future and services better for other people. So the feedback that we get in, we do feed it through to everybody who's responsible for providing health and social care services locally. So each health watch within their locality shares it specifically for their locality. As is the problem, sometimes things are cross-border, but what we do is we work for the Rochdale residents. So if it's a Rochdale resident and they've gone over to, say, a service over in Manchester, we collect that because they're a Rochdale resident. If it's a Manchester resident coming into Rochdale, the Health Watch Manchester will collect it because they're a Manchester resident. So it literally works off like where you pay council tax, basically, what you're, where that borough is that you're a part of the area. We massively ensure that services are held to account for how they use the feedback to influence the way services are designed and run. So sometimes services aren't always aware of things that might not be as good as they think they are, or where they could be. So they really do value, getting the feedback in from us so that they can help make them improvements. The Rochdale and Oldham MVP is hosted by Healthwatch. Again, there is MVPs right across England. They're a bit similar to Healthwatch, literally, they are all over the place. And some of them are combined. So we are Rochdale and Oldham, and the main birthing hospital in this area is the Oldham Hospital. So with the Rochdale and Oldham Maternity Voices Partnership is hosted by Healthwatch Rochdale, but we do get supported by Healthwatch Oldham as well. So we're sort of like linked together on it. The Rochdale and Oldham Maternity Voices Partnership complements the existing work that Healthwatch does in helping to ensure that people's experiences are used to help shape and improve services locally. So very much like Healthwatch, the Rochdale and Oldham Maternity Voices Partnership have a key part in gathering maternity feedback for services and care across Rochdale and Oldham. We do have our own website as a Maternity Voices Partnership, and that's the link there to the website. It's a work in progress, is the website at the moment. We try and update it as much as we can. We put events and information on there, and we have minutes from our previous meetings on there as well as the agendas for them. One of the things that make us similar again is Healthwatch Rochdale and the Rochdale and Oldham Maternity Voices Partnership. We look at the Norlands principles of governance. Now they're quite old, they're from the 90s of the Norlands principles, but they work with we both have these at like the core of the sort of like things that we do. So we work around selflessness, integrity, objectivity, accountability, openness, honesty, and leadership. So again, we sort of like mirror, but even though we're two completely different services, we gel well together in the fact that we both run alongside the similar things. So what is an MVP? So a Maternity Voices Partnership, or an MVP, is a multidisciplinary independent advisory group to the commissioners and local maternity services and systems. So we massively work alongside local services and what was the commissioners, now the ICB. So we do that, as well as we really ensure that everything we do goes back to the maternity trust, goes back to the people who deliver it and the people who who organise it. The whole thing is that we exist to ensure the voices of women, birthing people, partners and families are heard and responded to. One of the things that people do get us mixed up with a little bit is an advocacy service. So although we gather feedback in, good, bad, or whatever around maternity care and services and experiences across Rochdale and Oldham, we don't act on complaints. You can bring a complaint to us as like a negative feedback, and we can then signpost it elsewhere, to PALS or to the Advocacy Hub or to the Trust directly. But we do not take on caseloads of work. So we don't, if it comes to us as a complaint, we don't then follow that journey with you and take it where it is, because we're not an advocacy hub. And that's where some people do get a little bit confused with us. We value the experience and you're sharing that experience with us, but we don't act on that experience as a case as such. And again, like I said, we can, we do have other people in place who can help you on that. Sometimes things come through to us and they want to make it an NHS complaint. So again, we do signpost and help people on that journey to, we signpost them on elsewhere. Service users and service user representatives and the professionals work together to improve local services. So we don't just work on our own, we ensure that the feedback, again, a bit like Healthwatch, when the feedback comes in, whether it's good or it's feedback for improvement, we ensure that we work together with, with other people to make sure that, voices are heard and things are put in place. One of the things is that we create a functioning and sustainable MVP in all geographical areas, and it's part of a national maternity policy. So again, like I was saying before, a bit like Healthwatch, there is MVPs all over the place, and because they're required. And the main idea of them is the core of an MVP is co-producing things. So it's not just saying we think this should happen and this is how it goes. We make sure that we work with service users, other residents, organisations, groups, especially from like the voluntary community sector. We try and make sure that everybody has input into some of the things that we do, or helps us with creating of things. Sometimes we do get pieces of work through where people, they'll say, can you review something for us? And we don't not just one of us takes and goes, oh yeah, that's all right, or whatever. We make sure that we share it, as a group, to service users, to our contact list, for a more rounded approach to things. Our purpose and vision. So the sole purpose of the MVP is to champion the voices of women, birthing people and the families in the development of maternity service in Rochdale and Oldham. It's hugely around ensuring that the voices are heard, communicated and responded to. Also, the vision is to improve the experiences of maternity for women, birthing people and their families, through collaboration and co-production. And everything that we do as an MVP, whatever work streams we do, whatever things we do, we take back to the hospitals, it's always with service users' voices at the centre of it. So our upcoming next work plan will be due for April, for like our next year. And the areas that we focus on it has come through feedback trends. So we haven't just plucked out of thin air, that this is a thing to work on for, say, maybe breastfeeding. We've got feedback what's been coming in around lack of support or lack of areas or lack of information. So that's how we shape our work plan, by looking at the things in the feedback trends to make sure that we can try and make things better by linking it into our work plan. What we're about. So it's about working continuously to improve the quality of maternity care. And part of that, it's making sure that we focus on closing inequality gaps, because there is still inequality gaps in maternity care and services. Listening to and seeking out the voices of women, families and carers using maternity voice services. And the tagline of MVPs is like, even when that voice is a whisper. We're trying to enable people from especially diverse communities. Rochdale has 5 boroughs and Oldham's a massive area as well. There is so many different communities, what are in there. So we're really, really keen to ensure that, we hear all voices. Some of our priority work streams, what are due to be coming up to an end now, but some of these will carry on into the new year. The things that we've been focusing on for the last year has been maternal health inequalities across Rochdale and Oldham, looking at statistics, looking at how things can be made better, seeing if we can raise awareness of services better. Perinatal mental health, Rochdale especially has got a phenomenal early attachment team and the PIM service over here. Again, we've been ensuring people know about these services and that they can access them. Gathering feedback of maternity care and services, that is the core thing of what we're doing. That'll be ongoing forever. One of the things that we've been really excited about this last year is being able to visit once more. Like after that pandemic, everything were online. We couldn't go anywhere. We couldn't do anything. So one of the key things that we've been, really excited about this year is getting back out within the community, back into groups, listening to local voices, re-establishing community connections. And there's been so many new or changing organisations as well. It's been really nice to be able to go in and meet with people. We've done 15 steps at Rochdale Antenatal and at Oldham Antenatal. That was done a year ago, I think, beginning of the year it was. The 15 steps was basically where we went into both hospitals, and it was literally, it's the first 15 steps that you take in there. You look at what you see, hear, smell, feelings. Is it safe for people? So you look at a whole range of things, and you interact with people within there, interact with staff. And you have like a list of questions, what you're asking and what you're looking for. We have actually got the 15 steps report on our website. If anybody needs it, we can email it out to people as well. And within that report, there's also a number of recommendations of things what could have been improved. And again, at the moment, the Hospital Trust have embedded them within a maternity strategy plan, and that is something that we're actually doing at the moment, is following up on them recommendations, and we will be revisiting both areas in the future to see if them recommendations have been put into place. So far as we, our chair's been on a lot of meetings with this, and already quite a few of the actions have already been taken up by staff, and we do know that they have been done. So again, more towards in the summer, we will follow up further on that and see how the recommendations have gone. The Ockenden is probably something what some people are familiar with, what's been in the press a lot of, the Ockenden report, and the Ockenden 2 report came out I think just before Christmas. So we did, when the Ockenden 1 came out, we looked at the Hospital Trust website. We did a gap analysis on it. We looked at what was working on the maternity section of the website, if it were working for service users, how it could have been improved. And we found that a lot of the information on it, mainly because of the COVID pandemic, information was still very COVID related, or a lot, it weren't up to date as such, and some of it were quite complicated to navigate. So based on the recommendations that the MVP sent to the trust, they are literally redesigning the whole website. They're making it more relevant, easy to find information. more easier to find sections on it. So that's been, that's been quite impactful, that, that has gone on. Another thing is the equity and equality. That links on to from an Embrace, I think it's called, it's all around looking at, looking literally at equity and equality within maternity care and services. The Ockenden and the equity and equality moving into our new work stream from April. We're looking at linking it all together as a rounded, so that they're not all separate, sort of looking at them together, and that's in line with some of the work what the hospital are doing as well. We've done one of the other priorities is maternity improvement. The trust and all the other people who we speak to and the professionals, they really do value the feedback that comes in. So the feedback don't just come to us and stop with us and we keep it and don't do anything with it. It is really, really appreciated and talked about anonymously, because all the feedback we're getting is anonymised. So it does actually go to a lot of different people and places, and it is looked at. It is looked at how things can be made better. And the chair has regular update meetings with the team as well, feeding our feedback into them to make maternity improvements to the services. And another priority work stream has been breastfeeding, and breastfeeding again will be moving into our new work streams again. It's something within the hospitals especially. We did get a lot of stuff when it was National Breastfeeding Week, saying the difference in services across Rochdale and Oldham. Both areas are commissioned differently, they have different organisations in them both, but one of the things that we're really keen to do is try and there is a lot of services what do breastfeeding, but we're trying to do a one-stop shop, and we're looking at how we can sort of make people aware of all these different options what are available to them, maybe in just a leaflet or something like that, just so it's very, very easy for people to look at where they can go for helps and support on not just breastfeeding but infant feeding in general. So our MVP, we are made up of volunteers. So the MVP is a voluntary organisation. Our chair is Leona Barlow. She's been in place for 2 years now. We have our vice chair Josie, who's on the call with us as well today. This is an oldish picture of Josie because she's got another lovely little bundle at the moment now. And then we have our volunteer advocates as well. So we have a team of volunteers who they're called the Rochdale and Oldham Maternity Voices Partnership Volunteer Advocates. And they're the people as well who are out on the ground helping us massively ensure that we can gather this feedback in. So one of the things that we're always doing is we're always looking for volunteer advocates. And to be a volunteer advocate, you just have to be passionate about maternity care and services and passionate about wanting to make a difference. So the role of it is it's flexible. It's as many hours as you want to give, or it's entirely up to you. We don't dictate that you have to do 10 hours in a week. You can do 10 minutes in a day. It doesn't matter. The role is very, very flexible. And it's also variable depending on your skills, experience, time and interest. Some people are more interested in, for example, things around breastfeeding. Some people are more in, they have more interest in sling libraries. So it's whatever your interest in your, the things that you want to bring in, we can always adapt things, and we're happy to roll with things. It is voluntary. Even though it is voluntary, you can get remuneration for travel expenses and parking expenses. So you can ask for them, you can send in every month your remuneration for them. And we do ask people to sign up, if possible, for 6 months. The only reason we ask for a 6-month sign up is because in the first month, you sort of getting to know things. Second month, you're starting to do a bit more. So by the time your 6 months up is in, you'll love us and you want to stay for a bit longer. So we do ask that people sign up for 6 months just so that you get a bit more of a flavour of what we're doing. We ask that people be diverse and also passionate. You have to be passionate about it. One of the main roles of a volunteer is gathering feedback, and it's not just particularly going out constantly into community groups and that. It's basically from your friends and your family, people on your social media. If one of your friends has just had a baby, say, "Oh, have you heard about the Rochdale and Oldham Maternity Voice Partnership?" Send the feedback through, and it's just it can be a role as little as that. We're always asking people to promote and raise awareness of the MVP. Again, like I was saying before, there's still a lot of people who have never heard of the MVP, and especially people who are new to the boroughs or new to being, parents. There's still a lot of people who haven't heard about us. We ask that the volunteer advocates also, we have a meeting every quarter. So we do ask that everybody if they can come to the meetings once a quarter. They're by Zoom, they're in an evening, they're generally for around 2 hours. We ask that people share our social media posts, but even if you're not a volunteer advocate, it's wonderful if you can share our, reshare, retweet, all the rest of it, or even just hashtag or put, like tag us into posts as well, what you think might be of interest. Because again, we're really keen to show other services, because sometimes we don't always know what's out and about there, and other people might need to, even if it's just like it's a baby event, what's on, it'd be of interest to other service users, so we can reshare that, through our social medias. Again, sometimes the volunteer advocates are asked to do co-production things like leaflets or posters, or review things, especially things for the hospital trust. They do send sometimes leaflets in, what some of them can be quite outdated, or people will think the imaging isn't right. We feed that back to them and they adapt where they feel necessary, and then then we have a different thing at the end of it. And we do get asked to do a lot of surveys and questionnaires. Again, it's not essential that you do these. Again, some of the surveys and questionnaires people might not have experience of, or they might have no interest in. And so again, it's very, very flexible on what you want to do with your role of it. When you become a volunteer advocate, we do an induction. There is ongoing training offers as well. You get a lovely lanyard and a health watch pen. But we are trying to put in more time in the diary for the new year coming up, to try and meet up a little bit more in person, because we do have a WhatsApp group specifically for the volunteer advocates. And we do have online meetups and things, but we are hoping to be able to try and get together a little bit more face to face in this new year coming up. We have a terms of reference. It's the service users and the volunteer advocates and the chair and vice chair. It's a co-produced document. It's based on the National Maternity Voices Partnership, just a generalised terms of reference, and it's adapted to ensure that it's for our locality and relevant to our service users. It's a massively important document, and it's due for renewal at the end of March, ready for the new financial year. At the moment, we are asking people if they want to read through it, have a look at suggestions from it, if they think it reads fine, if there's any adaptations they think it might need, so that we can review it at our next meeting, which is at the end of this month. So if anybody would actually like to look at the terms of reference, we can send them out to you and ask people to review them where needed. Gathering service users' voice. So again, like I said before, this is one of the biggest things that we do, and it's lovely listening to some of these birthing stories. It really is, and every single person has a different experience. I don't know anybody who's ever had, I've gone, oh well, I heard about that last week. Never happened. Everybody's story is their own story. So the feedback that we gather is really important, but also it's really important to know that when the feedback comes into us, we don't share identifiable details with it unless people want us to, if we needed to raise it for something else, if it were a complaint or such. So everything is anonymised, all identifiable things is removed from our feedback. So one of the things that like I said before, the volunteers do is, they try and gather this service user voices. There's a number of ways that we can gather feedback alongside the actual, the MVPs. But also we have a direct feedback link, which is on our web page. So it's like an online web form where you can type into it that your experience. We have a telephone text service, which I'm really keen for people to use. When we set this up, we thought it'd be a really good idea, because people are always on the phone, they're always texting, and I've never yet had a piece of maternity feedback via that text number. So if anybody would love to make my week and send some maternity feedback via that text number, I'd be very excited. Again, it's hugely around being on engagement at the ground. We're really keen to go into if people have got events on, baby fairs, sling libraries, groups what are on, baby groups. We're really, really keen to get into there so that we can gather these voices and feedback. Again, we have a Feedback Friday campaign. Every week we post on our Instagrams and our socials, hashtag Feedback Friday. Some of the examples are at the bottom of things that we ask for feedback on. We've got a QR code, because since COVID, there's a lot of QR codes floating around. So, that links directly to our feedback form. But also on the website, with the feedback form, we do actually have the tab where you can change the language of the whole page and the whole form and everything. So if people do wish to change it to, whichever language they wish to, there is an option to do that, and it will come through like that as well. And so that's, a lot of people don't know about that feature. So it is there if people, want to use it. And engagement, this is where I'm going to hand over to Josie. So Josie is our vice chair. She's been in place as a vice chair for a year, but prior to that, she was one of our wonderful advocates. And Josie rallies our advocates around, and herself goes and does the majority of the engagement. And the photographs here are just a few examples of some of the things that she's done over the last year. So Josie, I'll hand over to you.
Wonderful. Yeah, so as Naomi has just said, my role as vice chair is basically engagement, and that's what I do. I get out into the community, into already existing groups and places where there's women that have had babies or children up to about 3 years old, and just basically go and just chat to them, get them to fill in a survey. But yeah, and a lot of our feedback, as well as what we get through the online survey, a lot of the feedback is like anecdotal feedback that we've got through conversations that we've had. And I love a birth story. About you, Naomi. But yeah, and it's a really privileged kind of position to be in, because you hear such different experiences from lots of different people. So some examples of some of the engagement we've done over the past kind of few months. So we've been into a lot of the children's centres in Oldham, and into their baby play and toddler play sessions, and I've spoken to a lot of people there. As you can see in one of the photos at the bottom there, that's myself and one of our former volunteer advocates, Michelle, who's unfortunately emigrated now, but she was amazing. That's us at one of the baby fairs, like the pre-love clothing and things, baby equipment fairs. That was quite a nice one. We have got coming up, or each month now for the next 5 months, we've got sessions booked in at Rochdale Infirmary Antenatal Clinic, and I am currently working with Jules from Health Watch Oldham to try and do the same for Oldham as well. And then something really, really exciting coming up on the 1st of April, we are going to be hosting a maternity corner at Oh, there we go. So I love the company called Theatre and Flow are hosting this clothing swap shop, and for the first time we're going to be having like a maternity corner there, because one of our other volunteer advocates, Vicky, was saying it's maternity and nursing clothing as well. It doesn't just stop once you've had your baby. Like if you're breastfeeding, like nursing clothing is so expensive, and it's the kind of thing that you don't really, or maternity wear especially, something that you don't really wear for that long. So we are appealing at the moment for people's donations of unwanted pre-loved maternity wear that we can add to our little maternity corner. But I'm really excited for that one. When I was having a planning meeting with the lady that's running it, called Mimosa, yesterday, she was saying we get a lot of women that have come as refugees, a lot of women that like are on the breadline, are struggling. So, and it's just a really good opportunity for us to, speak to those people that we wouldn't necessarily normally see at your standard kind of baby groups, people that, are like that minority as such. So yeah, just a few examples. We've got some lovely, really keen volunteer advocates that we've just recruited, haven't we? And yeah, everyone's really keen to get going with this. So as Naomi said, now COVID seems to be a thing of the past. Yeah, we can get out to these, these groups and events as much as possible, and it's something that I really, really enjoy doing. So yeah.
Oh, thank you, Josie. Yeah, that's it. We just need this snow to hold off what's imminently coming. Yeah, so if anybody has got any donations of maternity clothes or nursing wear that they'd like us to collect, or would like Mimosa from Theatre and Flow to collect, please do let us know, because you'd be surprised at how many people probably won't even realise that they've got bits tucked away in the cupboards and stuff like that. Or if they were like me, I was still wearing maternity clothes 2 years in. But if anybody does want to, donate anything, or they've got items to drop off, or you're more than welcome to come to the event. When you come to the event, you do get tokens to and if you don't need maternity, there is racks of not, just usual women's clothing, shoes, handbags, everything there. They are a fantastic event, and it's good partnership working. It's something we're really, really looking forward to. So yeah, so if anybody does want to drop anything off, or they've got any donation, or come along, please come and have a look for our store when we're at it. Linking on from that is reports. So we've been involved in a number of things over the last year. As I said before, about the 15 steps. We did work really closely as a Health Watch and MVP with Cartwheel Arts, looking at racial inequalities. We did some really wonderful, what are they called? It were like art sessions over a number of weeks, looking at maternity journeys and looking at it creatively. So the ladies made a journal. They looked at different experiences, looked at words to describe it, emotions and things like that. It were really, really good. And at the end of it, the ladies shared like their birthing experiences and stories as well. All the ladies were South Asian on it, and it was just lovely because they also incorporated a lot of traditional imagery and stuff like that into their journals, and it was just a lovely project that we were part of. And then we were part of a Baby Bubbles project as well. This were looking at people's experiences of having babies, being pregnant and birthing during the COVID pandemic, and it were a really interesting project again to be part of. Linking on from that, the Baby Bubbles are still being rolled out through Home Start as well. I think they're still going out at the moment. And again, it were really good when we did the Baby Bubbles. People were only just sort of like getting back together, so there was still a lot of trepidation about people getting together. But people bonded and made some really good friendship groups from these Baby Bubbles. So they are, it's a very good service. But again, all these reports, we can either send them to people or they are available on our webpage as well to download as PDFs. Campaigns, we love a good campaign, and we especially like today, it's International Women's Day, we're embracing the equity. We did things for, we put things out on social medias. If it is a certain theme as well, we try and get as many like campaign leaflets and information so that when we are out and about in the community, we can share them. Some people still don't understand or know things about like Strep B. So when it was in July, I think it was, when it was that awareness week, we've got a lot of materials there, and people were saying to us, oh, we had this, but we didn't really know what it were. Again, so if we can raise awareness of certain things, we're all for it. Again, we do put a lot of our stuff on our social medias. We have Twitter, Instagram, and Facebook. So we do put a lot of stuff on there. But again, if anybody wants to share anything for them, again, we can do that. We have, as I was saying before, multimedia platforms. Our Instagram was new. We did have a Facebook and a Twitter page previously. The Instagram is quite new. I think we've only had that just over a year. I think the Instagram's been on. And again, we've got a steady stream of growing followers on them. So if you don't already, now is the opportunity to go and follow us on all our social medias. We do put updates on it. On Facebook, we have 2 pages as such. We have our official MVP page where it's more things like meetings and stuff and asks for surveys and stuff. But we also have an MVP service users group where other organisations share a lot of things in there. So baby groups, baby massages, aquanatal, other things what are going on and what isn't just MVP, it's more for everybody else. And there's some really interesting things on there. And it also, again, other people, we have midwives who post on there, we have people from other teams who post on there about their services. So it's a bit like a raising awareness page as well. So yeah, you can always contact us at our email address, which is info@romvp.org.uk, or you can telephone in and it'll come through to the Health Watch office, and it's 01706 24. Oh, actually, I forgot the number. What is it? Oh yeah, it is. It's 01706 249 575. I had a mind blank moment then. So if people do want to ring through or give feedback, or they've got a query or an inquiry, you can ring through as well. We are generally out and about in the communities, and again, if people have questions about things and we don't know the immediate answer, if people are asking us stuff, we can take your phone number or your email address, and we can go back and find that information for you and signpost the information that you need and get back to you at a later date if we don't know immediately. Meetings, our chair is Leona in the middle with the flowery top on. Leona has does a lot of more like higher strategic meetings. She has a lot of involvement with the trust. She has a lot of meetings over at Oldham with varying different, midwifery teams and professionals over there. She also does meet with the lived experience team. We've got some really good, well, I'm saying really good, we've got some amazing engagement midwives who have just been recruited from the lived experience team, and over the next year we're going to be working really closely with them, going out and about in the communities and at the hospital, again looking at lived experiences, gathering that feedback. As an MVP, we have quarterly meetings. They're generally like spring, summer, autumn, winter as such. At the moment they've all been online, and they are all in the evening. We have trialled them previously in the daytime and at different times, and they've not been very successful. Being in the evening, we do tend to get a lot more people who do join them, and each meeting has a theme. So again, the themes for the meetings come from feedback trends what are coming in. We've got a meeting at the end of this month, which I'll tell you more about with I think it's the next slide. But the theme for that is the new Badger Notes, which is the new. They're getting rid of the green paper form of your notes, and it's going onto an app now. So they're literally digital maternity notes. Obviously they're in their early stages, but we're looking for people's experience of them, what they found went well, what they found hasn't gone so well, things they think needs to be on there. And we've got the team from Badger Notes joining us at the next meeting as well, so they'll hear firsthand, like that feedback in, because they want to do what's best for the service users. They want to make sure that Badger Notes, BadgerNet is working properly, and how they can make improvements on it. And we do meet up as volunteer advocates as well. As I was saying before, our next meeting is on Monday, the 27th of March. It starts at 7:45 and it goes on till 9:15. Generally finishes about 9:30. We always tend to roll over a little bit. We do have a set agenda for them as well. We do send the agenda out beforehand with the previous minutes from the meeting before. As I said before, the theme for this one is it's like a yearly roundup, because it's another year, another year end as such. Look at all the stuff that we've done for the last year, what impact we've made. Again, look at themes and trends, and again the focus is on the BadgerNet. On the meeting, we do have a wide range of people who come to these meetings. We have service users, we have groups and organisations, we have professionals, and we also have people who come from Royal Oldham Hospital. We have the director of midwifery or one of the team on there as well, and they do answer questions. If people have got specific questions they want to come bring to the meeting, generally somebody on the meeting can answer the questions, but again, like I was saying before, we can get back to you with answers to the questions. If people can't make the meeting and they've got a question around a specific thing, or specifically around the topic that the theme is, again, they can email the questions in or ring through with the questions, and we can bring it to the meeting so that it's asked in the meeting, and we can again get back to people with the answers. These meetings are by Zoom, and to be able to come on board with them, if you send an email to either HealthWatch or to the MVP, we can send you the joining link when they come on. And that is my last slide. So it is literally like a whistle stop, a very short snippet of the MVP, a very brief on some of the, because we do so many things, but it is quite a brief thing on what we do. So I will open it up if anybody's got any questions.